Have you ever woken up with jaw pain, headaches, or teeth that look a little flatter than they used to? You might be grinding or clenching your teeth, a condition called bruxism. In this video, we'll walk through what bruxism is, why it happens, what can go wrong if it's ignored, and most importantly, what you can do to protect your teeth and jaw. We'll cover both professional treatments and practical at-home prevention strategies. This video is for education only and does not replace advice from your own dentist or doctor. Bruxism is the medical term for grinding, clenching, or gnashing your teeth. It can happen while you're awake, often during times of stress or deep concentration, or while you're asleep, when you may not realize it at all. Sleep bruxism is considered a sleep-related movement disorder and often occurs alongside snoring or sleep apnea. Many people occasionally grind their teeth with no major consequences, but when it happens frequently or with a lot of force, it can cause real damage over time. Bruxism rarely has a single cause. One of the biggest contributors is stress. When you're anxious, frustrated, or under pressure, your body tends to hold tension, especially in the jaw. People may clench their teeth without noticing or grind them at night as their brain processes stress. Lifestyle factors can add fuel to the fire. High caffeine intake, nicotine, and heavy alcohol use all make nighttime grinding more likely. Certain recreational drugs and some prescription medications, including a few antidepressants, have also been linked with bruxism. Never stop a medication on your own, but if you notice jaw pain or tooth grinding after starting a new medicine, it's worth discussing with your prescriber. Your bite and jaw alignment may also play a role. If your teeth don't come together smoothly, or if you have missing teeth or unstable dental work, your jaw muscles may overwork to find a comfortable position, leading to clenching or grinding. Sleep disorders are another important piece. People with obstructive sleep apnea, loud snoring, or fragmented sleep are more likely to have sleep bruxism, possibly as the body's effort to open the airway. Neurological conditions, such as Parkinson's disease and certain forms of dystonia, as well as a family history of grinding, can also increase your risk. So how do you know if you might have bruxism? Many people first hear about it from a bed partner who notices grinding sounds at night. You might wake with tight or tired jaw muscles, difficulty opening fully, or pain in front of the ears near the jaw joint. Morning headaches, particularly in the temples, are common. Look at your teeth in the mirror. Flattened, chewing surfaces, tiny chips or cracks, worn down enamel, and notches near the gum line can all be clues. You may also notice tooth sensitivity to cold or pressure, and soreness in the neck or shoulders from constantly tensing those muscles. When bruxism goes untreated, the problems can add up. Chronic grinding can wear teeth shorter and thinner, increasing the risk of cavities, fractures, and even tooth loss. Dental restoration, such as fillings, crowns, and veneers, may chip, loosen, or fail sooner than expected. The jaw joints, called the temporomandibular joints, or TMJs, can become inflamed, leading to popping, clicking, or pain when you chew or yawn. Some people develop difficulty chewing, locking of the jaw, or constant facial pain. Bruxism can also disrupt sleep for you and your partner, and in severe cases, it may worsen existing jaw or head pain disorders. It's important to get a proper evaluation if you suspect bruxism. A dentist will ask about your symptoms, examine your teeth and jaw muscles, and look for wear patterns, cracked teeth, or signs of joint stress. They may ask about your sleep, stress levels, medications, and medical history. In certain cases, especially if sleep apnea is suspected, you may be referred for a sleep study. See a dentist or doctor promptly if you have persistent jaw, face, or ear pain, frequent headaches, broken or loose teeth, difficulty opening or closing your mouth, or loud grinding that disturbs your sleep. Treatment for bruxism usually combines protecting the teeth, calming the muscles, and addressing underlying causes. A very common tool is a custom mouthguard or splint, often worn at night. This doesn't necessarily stop grinding, but it cushions the teeth and spreads out the forces so they're less damaging. In some cases, dentists adjust the bite by reshaping tiny areas of enamel or rebuilding worn or missing teeth so the jaw can close more evenly. If bruxism is linked to stress, anxiety, or sleep disorders, working with your primary care provider, therapist, or sleep specialist often becomes part of the plan. In moderate to severe cases, additional treatments may be recommended. Physical therapy or jaw exercises can improve muscle balance and joint function. For some patients with severe muscle overactivity, injections of botulinum toxin, often called Botox, into the chewing muscles can reduce clenching strength and pain for several months at a time. This is usually reserved for stubborn cases and must be done by a trained professional familiar with facial anatomy. When bruxism is associated with medications or neurological conditions, your healthcare team may adjust drugs or add treatments to lessen grinding while still controlling the main condition. Alongside professional care, self-care and daily habits make a big difference. Start by noticing when you clench during the day. Your teeth should only touch lightly when you swallow or chew. At rest, they should be slightly apart, with your lips closed and the tongue resting gently against the roof of your mouth. If you catch yourself clenching, gently drop your jaw, wiggle it side to side, and take a slow breath. Avoid chewing on pens, ice, or your fingernails. And try not to chew gum for long periods, which can tire the jaw muscles. Reducing overall stress can ease bruxism, especially at night. Relaxation techniques such as deep breathing, progressive muscle relaxation, gentle stretching, or a warm compress on the jaw before bed can help. Build a wind-down routine and keep a consistent sleep schedule. Limiting caffeine later in the day and moderating alcohol and nicotine, especially in the evening, can also reduce grinding episodes. Regular physical activity, staying hydrated, and treating conditions like heartburn or allergies that disturb sleep all support healthier sleep and less clenching. Bruxism is also common in children, especially during growth spurts and when new teeth are coming in. Many kids grind at night and then grow out of it as their jaws and nervous systems mature. Still, it's worth mentioning to your child's dentist, especially if there is tooth wear, pain, or snoring. The good news is that bruxism is manageable. By understanding the root causes, protecting the teeth and joints, and building healthy stress and sleep habits, most people can significantly reduce symptoms and prevent long-term damage. If anything in this video sounded familiar, consider scheduling a checkup with your dentist to create a personalized plan.